fatigue, weight gain, even on a low-calorie diet, depression, constipation, cold feet and hands, muscle cramps, dry itchy skin, hair loss, loss of the outer third of your eyebrows, stomach pain, gas and bloating, edema, brain fog. If you've been experiencing any of these symptoms, it's highly likely that you're experiencing a low-functioning thyroid, even if your lab tests are normal. Now, heart palpitations, inward trembling, increased pulse rate, insomnia, night sweats, feeling nervous or distressed, or difficulty gaining weight, these are symptoms of a hyperactive thyroid. But what if you've been experiencing some of the symptoms from both of these categories? Well then, you fall into a category with about 80% of the thyroid patients that I see in my office, and that's an autoimmune thyroid. Hello, and thank you for requesting my video, Thyroid Solutions That Work. I'm Dr. John Filippini, and the information you're about to hear is probably going to confirm what you're already suspecting. You have a thyroid or an autoimmune condition. Now, although your doctor may have told you your labs are normal, it's all in your head, the hormonal changes are just part of the growing old, I'm going to share some great information that will excite you, give you hope, and motivate you to take action now. You'll never be at a better place in your health than right now to start taking your health into your own hands. Every day you let pass, you'll get sicker, and the road to recovery will be that much longer and that much harder. So sit back, take a couple of notes, because I'm going to ask you a few questions along the way and give you a short quiz at the end of the video. Now, first off, I want to be very clear that I'm not a medical doctor, a cardiologist, an oncologist, or the type of doctor that only focuses on one area of the bodyologist. I received my doctorate in chiropractic back in 1988, but I utilize all my postgraduate education in functional medicine, functional neurology, holistic medicine, nutrition, and frequency science, which I'm going to have my son Jeremy, our frequency specialist, explain a little bit later. It's the combination of all these practices that allows me to determine the underlying cause of my patient's condition and gives me the necessary tools to help them reverse it. Now, here's my first question for you. Why does your doctor wait to start treating you until the thyroid numbers are so bad that he can finally diagnose you with a thyroid disease? Shouldn't there be a treatment step in between the phrases, I can't diagnose you, or now you're on hormone replacement therapy for the rest of your life? Every living cell in your body has thyroid receptor sites. This means that the thyroid is going to have an impact on your bone metabolism along with your parathyroids, which is why low thyroid function results in osteopenia and osteoporosis. It also affects your immune system, which is why thyroid sufferers can experience other health disorders due to a failing immune system. And this is why I always run a full thyroid panel on anyone suffering with a chronic disease process, including diabetes, fibromyalgia, osteoporosis, insomnia, dementia, digestive disorders, you name it. I mean, there's really no chronic health disorder that couldn't potentially have an underlying thyroid disorder, at least contributing to the problem, if not actually causing it. The thyroid also affects the brain and the nervous system. And as you'll learn, the brain and the gut have a very intimate connection, both which are heavily impacted by thyroid function. This is why brain fog, depression, anxiety, and nervous disorders are so common among thyroid sufferers. And listen close to this one. Every endocrine gland in your body responds to thyroid hormones. Endocrine glands are what make hormones. Over 600 hormones are made to communicate and instruct the tissues and cells in your body how to behave. And this is one of your body's major communication systems. Could you imagine what it would be like if your telephones and computers and every other source of communication went on the fritz? It would result in chaos, right? Well, that's what can happen when your thyroid or your thyroid pathway goes on the fritz. Complete chaos. Another important function the thyroid affects is the gastrointestinal system. Your gut comprises up to 80% of your immune system and is responsible for about 90% of all disease processes. The thyroid impacts everything from the hydrochloric acid that the stomach secretes to the bile excretion of the gallbladder and pancreas function and the contraction of the small intestines and colon. And this is why a low-functioning thyroid patient has a 9-fold increased risk of having their gallbladder removed and suffers with bouts of constipation, heartburn, acid reflux, pancreatitis, and every other digestive disorder, including cancer. And when the gut has problems, the brain will have problems. Both the gut and the brain are heavily saturated with immune cells. Approximately 90% of your brain cells are immune cells called microglia. And as I've already mentioned, up to 80% of your immune system lives in your gut. And the various parts of your immune system communicate with one another. So when your immune cells are activated in the gut, such as when they're exposed to certain foods, the brain's immune cells are signaled, and then they go into a state of defense and become inflamed themselves. This is what causes the brain fog, depression, OCD, insomnia, chronic pain syndromes, or other neurological symptoms. The liver is heavily impacted by the thyroid dysfunction as well. And this is why a thyroid patient starts off taking thyroid hormones and then ends up on cholesterol medications, high blood pressure medications because of the effect on the cardiovascular system, and even antidepressants because of the impact on the brain and the central nervous system. If the condition goes on long enough, they usually end up on diabetic medications as well, and sometimes many others. But the thing I see thyroid patients suffer with the most is with the effect on their metabolism and fat burning. This is due to the effect on a growth hormone, insulin resistance, which eventually leads to diabetes, a leptin resistance, which is your fat storage hormone, and the energy output of all the cells in your body, which is what regulates your body's metabolism. You see, when your thyroid breaks down, any and every cell, tissue, and system can potentially break down as well. I can't think of any other gland or organ that's as crucial to your overall health other than the brain itself. And speaking of the brain, this is where the thyroid pathway begins. It starts with two small superglands called the hypothalamus and pituitary glands. The hypothalamus releases the hormone thyrotropin-releasing hormone, or TRH, which signals the pituitary to secrete thyroid-stimulating hormone, or TSH. This is the hormone that signals the thyroid to make thyroid hormones as it produces an enzyme called thyroid peroxidase, or TPO. The thyroid makes two kinds of hormones. One is essentially inactive, which is the T4. T4 has 4 iodines attached to it, so it's too large to attach and interact with the thyroid receptor sites of your cells. The other is T3, only having 3 iodines attached. This is the active thyroid hormone that can react with your cell's receptor sites, at least once it's released from the protein-bound carriers that shuffle it throughout your body. But it only makes about 7% of the hormones your thyroid makes in the form of T3. The other 93% are in the form of the inactive T4. So this begs a question. Why does your doctor only test for TSH when he runs a thyroid panel? The answer to that, I'm afraid, is going to kind of tick you off. Your doctor never plans on fixing the problem. He's not trained to do that. His job is to merely put you on enough thyroid replacement hormones to trigger the feedback mechanism to the pituitary to stop signaling the thyroid to produce any more thyroid hormones. He's literally shutting down your thyroid function. This pretty much guarantees that you'll be a patient for life, dependent upon that thyroid replacement hormone. You see, to fully understand what's happening in your thyroid pathway, there are 8 to 10 markers that need to be checked. Yes, TSH is important, but that doesn't tell you how much inactive T4 is being converted to the active form T3. It doesn't tell you if the protein carriers are releasing the free T4 and the free T3 to do their jobs. It doesn't tell you how much of the free T3 is being taken up into the cells either. And it certainly doesn't tell you if your body's producing antibodies against your thyroid or other tissues. But your body is wonderfully created to convert the T4 into T3, and this takes place mostly in the liver, but to a lesser degree in the gut. But it's the T4 that signals the pituitary to slow down on the stimulation of TSH, so the thyroid slows its production of the thyroid hormones. The problem with this system is that if your liver or gut isn't converting the T4 to T3 properly, even though your TSH and T4 levels appear normal, you'll still have symptoms of hypothyroidism. And if you're autoimmune, your TSH is going to be up and down like a roller coaster, depending on the stage of the disease. That's why some days you'll have hypothyroid symptoms, while others you'll experience hot flashes, heart palpitations, or inner trembling. But everyone doesn't respond the same way. You may simply be gaining weight or experiencing cold feet all the time, or suffer with insomnia. An autoimmune thyroid is treated completely different, or at least it should be. It's a problem with the immune system, not the thyroid. Now here's my second question. If you have to take medication to manage your thyroid condition that eventually leads to taking more medications to manage cholesterol or blood pressure or diabetes or whatever, if you have to take those for the rest of your life, are they actually fixing the problem? And is your health getting better or worse while these medications manage your numbers? Here's the good news, what I do in my office to give my patients such incredible results.
I was basically tired of being tired. I wasn't feeling well. I was exhausted all the time. I was gaining weight, and I was just tired of being tired, and something had to change.
Well, I started coming because I was hurting. All my body was in pain. So I was looking for something to take away my pain and I couldn't find it. I went to the doctor and it didn't help. They said that I have fibromyalgia. Pills and everything didn't work for me. Nothing did. A couple years ago I got really sick and I couldn't eat anything. Every time I ate, my stomach was killing me. A bunch of different doctors. Went to my regular doctor, a gastroenterologist, an allergist, a surgeon, acupuncturist, a bunch of different doctors, and they just kept giving me pill after pill that were making me worse. They kept running tons of tests, and they suggested possible surgeries. Like they said, we could take your gallbladder out and there's a 50-50 chance that that will help, or we can try to repair your acid reflux valve.
I went to my regular doctor, which through my health plan, through work, and they told me there was nothing wrong with me and that I just needed to diet and exercise more and I would lose the weight and I'd have more energy. But I knew that wasn't going to work because I'd already tried doing that stuff and they weren't listening to me.
I was so tired and my whole body was hurting. I did that for about a year and nothing was helping, and I wasn't willing to risk surgery for a 50-50 chance. So I knew that there had to be something different, something else to try. Well, I tried all those different doctors and I don't even remember all the different pills. They put me on the proton pump inhibitor. I'd been on that for a while, and I don't even remember all the pills that they gave me to try, but I would only ever try them for a couple days because they just would make me worse and they weren't helping.
First of all, I found someone who listened, which is, okay, you're going to have to turn that off for a minute. I'm going to get all emotional. I found out I had cancer. Wasn't what I wanted to hear, even though part of me probably knew there was something seriously wrong with me. My thyroid wasn't working right because I had a mass in my thyroid. But I knew in my heart I did not want to do chemo. And he was able to find out what was wrong with me. And it turns out I had cancerous mass on my thyroid and I had leukemia. And that explained the weight gain and me being tired all the time.
Lots of results. I wasn't able to get out of my car the first time that I came here because I was hurting so bad. A bunch of things. I had more energy. So many things that I wasn't able to do at home or at work, now I can do. I can go to the gym. Well, I can eat again. I used to get headaches every day, and now those have drastically diminished. Since I was in high school, I used to play soccer and I had to wear knee braces way back from my freshman year because I always had pain in my knees even when I ran a tiny bit. And now that knee pain is pretty much gone and I can exercise more and I don't need to wear knee braces. I used to get numerous sinus infections every single year. This year, since coming here, I haven't had any sinus infections at all. So for the first time since I was like a freshman in high school, which we won't talk about how long ago that was.
We will resensitize your thyroid receptor cells so that they can absorb the thyroid hormones, and we'll make sure the inactive form of the thyroid hormones is getting converted to the active form so they can interact with your cells. We'll use nutraceuticals to detox, repair, and stimulate proper thyroid function. For those who are autoimmune thyroid, we'll run the proper test to determine what's triggering your immune system, and we'll teach you how to calm the immune attack on the thyroid by eliminating those triggers. We'll then teach you about the proper nutrition that allows the thyroid to start healing and functioning properly. For those of you who don't have their thyroid anymore, we need to address the rest of the body to make sure your thyroid replacement therapy is effective. Along with the thyroid, it's necessary to repair and improve the structure and function of any of the glands and organs that aren't able to function properly and have been damaged along the way. We'll improve the structure and function of the liver through detoxification and specific nutraceuticals, and you'll see the cholesterol, triglycerides, and LDL levels begin to drop, as well as the blood sugar and liver enzyme levels. For those with insulin resistance, I put my patients on a special formulas of nutraceuticals, which then resensitizes cells to insulin, causing the serum glucose to drop to their normal levels. Now, once we regulate blood sugar levels, we'll address the adrenal glands. We'll detox them and get them functioning optimally, and again with various nutraceuticals. We'll kill off unwanted bacteria in your gut, build up the good, desirable bacteria, and repair the intestinal walls, which are many times damaged and leaking. We'll kill off parasites that are hiding in your cells, get rid of hidden toxins and infections, increase your vitamin D levels, and decrease the inflammation throughout your body. Not only do we work with powerful doctor-grade nutraceuticals to get the appropriate nutrition to the tissues and the organs in the body, but we also have advanced technology that allows us to repair the damage that has been done to them as well. Now, we have over a dozen different treatment modalities that we utilize in our office that detox, repair organs, regenerate nerves, stimulate the immune system, decrease inflammation, and speed recovery time from acute injuries and chronic diseases. Things that might take months or years, or maybe even never heal or recover from, can now be done in a period of weeks to months. Now, here's my son Jeremy, our frequency specialist, to discuss and help explain frequency and energy as it relates to your treatment and health.
Hi everybody, my name is Jeremy and I'm the frequency guy here at Dr. Filippini's office, and I've had the privilege of spending over 1,000 hours researching these frequencies, both the harmful frequencies and the not so harmful frequencies. And what I found is there are some frequencies out there that will actually heal us. And so what I'm going to do is I'm going to try to attempt to condense all of this information for you, so that way you and I will both understand it on my level. So first off, if we were to take a microscope and you were to look at a molecule and continue to go further and further smaller into that molecule, you would eventually see that that molecule is vibrating, and it's vibrating at a very specific frequency. And what researchers have found is that everything is energy. And so what we can do is we can go in and find out what the different resonating frequencies are of different cells within inside of the body. If they're not healthy, well, they're going to be oscillating or vibrating at a different frequency. And so what are we talking about? Things like parasites and pathogens and bacteria. All of those things will cause your body to resonate at a not so high frequency. Thus, you will become unhealthy. Now, I'm not going to talk to you about your telephone or your TV or about your laptop and how dangerous those frequencies are, but rather I'm going to talk to you about the stuff we have at our office. And these are the things that are going to be helping you get better faster. With these frequencies, we can address things like degenerative arthritis and neuropathy, thyroid problems, cancer, Lyme's disease. You name the disease process, what we know is there is a resonating frequency to all of those different processes. Now, we also know about the gold standard of what these frequencies are, and it's called the MRI. And so if we need to go in and get a picture of your body, we're going to go in, take you to the MRI place, and they're going to give you a scan. Now, this isn't actually taking a picture of your body, but what it's doing is it's taking the different cells and it's causing them to spin at a certain rate. And once that starts spinning, it produces a certain type of void. We then take a sort of an image of that void and it turns it into a film, and now we're able to see what's going on inside the body with the MRI. Well, there's other technology that does the same thing, and what we've done is we've hooked it up to a computer, and this technology is Dr. Royal Rife's technology. And what he did is he took these small microscopes that I was talking about earlier, and he was able to go over 10,000 times magnification. So if you think about it, that's like infinity going small. And so what he found is that every one of these bacteria and funguses and parasites all vibrated. And you actually see them. They look like little jellies on a plate. And so what he did is he took these frequencies and zapped those different bacteria with it. What he did is he caused them to pop. Back in the 1920s, this guy, Royal Rife, was curing cancer. We now are able to take that technology and we're able to apply it to your health today. It's kind of like Ella Fitzgerald, the lady that has that beautiful voice. Well, she was able to break a wine glass with her own voice. And it's not that her voice was able to get so high of a pitch or super low pitch, but what she did is she was able to tone her voice to the same vibrating frequency of that wine glass. And so once you flick the glass, you're now able to see her match that frequency and she will cause it to pop. You can actually go on to the internet and see little children doing the same thing because there is something to this. So when the Rife machine detects those specific frequencies, what we're going to do is we're going to take it back from our computer program and we're going to now deliver that same frequency back into that bacteria, essentially causing it to pop. Physicist Nikola Tesla. He was a guy who totally understood frequency, and what he told us is if you want to understand the secrets to the universe, understand frequency, vibrations, and resonance. Our body, just like the Earth, also has an electromagnetic frequency, and so what we've learned is these frequencies can penetrate our electromagnetic field, causing us to become unhealthy. So what we do is we use these other technologies like our biocharger. We also use the Rife machine. We have the Hocomet as well with inside of our office, and we're able to go in and electrically and biochemically change the resonance of your cells inside your body. Now our body, just like the Earth, has an electromagnetic field. Let's put it a little bit simpler. If your body was a tuning fork and we took another tuning fork and it was tuned to the same note, like a C, it would vibrate. So you tune this one, you cause it to flick and you cause it to make some noise. This other tuning fork over here is going to begin to vibrate at that same tone, simply because the vibrating resonance is going to do that. Getting back to our biocharger, this is Nikola Tesla's technology, and then we are utilizing his Tesla coil, and the biocharger also has Rife's technology with it because we're delivering these frequencies using the photon light beam, which is what made it so successful in being able to kill off these other bacteria and parasites. The biocharger produces such a powerful frequency that right there your DNA begins to repair, and it actually stimulates your own stem cell growth. The same thing that people will go and get stem cell injections for and pay thousands of dollars. Your body's perfectly capable of doing that when it's healthy. And so what this biocharger is doing is it's simply raising the resonance and the vibrations of your cells so that way your body can do it naturally all by yourself. The cool thing is if all we had in the office was the Rife machine and the biocharger, we would be able to help most any condition out there. But we also utilize other things like that Hocomet machine I was talking about earlier. This produces an electromagnetic frequency, but it also produces a biochemical frequency. So when I put these pads on your legs or put it on the bottom of your feet, what's going to happen is your cells are going to begin to vibrate. And as they become healthier, the neuropathy gets better. The pain and the burning and the numbness and the tingling in the hands and in the feet, it gets better. Research has shown us that our cells can vibrate or oscillate at over 1,000 hertz per second. And what these TENS units will do is they might be able to produce about 100 hertz, which is why when you put those pads on, it'll cause your muscles to vibrate a little bit, but it's not necessarily affecting or directing the actual cause of what's going on inside the body. And that's where this big guy comes in, the Hocomet, because it's able to produce a little bit more powerful frequency so we can get the healing faster and stronger. Now, the last one I'd like to tell you about is our pulse EMF, also known as the PEMF. There's studies outside of some Texas universities that are showing that if you were to dissect the tibia of a rabbit, leave it for 30 days without this pulse EMF, when you come back to it, the rabbit still has a broken leg. The tibia is still gone. But when we introduce this pulse EMF to that same tibia, to the rabbit, within a 30-day period, the tibia actually grew back together as though it had never been broken. The DNA in the stem cell was basically told to start growing again. So that's why the rabbit foot. We have that technology here in the office, so we can address things like cartilage within inside of the knees, or address your ligaments and tendons. in a way that all you have to do is sit next to this machine and be comfortable. So the use of these machines has been around for over 100 years. Nikola Tesla in the late 1800s, Royal Rife in the early 1900s, and yet we haven't been using it. I didn't learn about these guys in school, so what's going on? Cool thing is we have it now, so we're going to be able to utilize it and make sure you get better faster. Thomas Edison stated that the doctor of the future would give no medicine. Albert Einstein said that the medicine of the future would be frequency. You guys, we are that future.
And yes, well, we'll do this all in a matter of months, a little longer for extremely complicated cases. Now here's my third question. If medications only manage your symptoms, doesn't it make sense that you need to fix the underlying cause of the symptoms and get off the dangerous drugs that can cause such horrible side effects? Now, I can only be as excited about your health as you are. Now, I'll team up with you. I'll run the appropriate tests, give the proper recommendations, and I'll even get in the trenches with you and everything I can to reverse the disease. But there are requirements on your part as well. There will be dietary and lifestyle changes. For instance, you can't be eating excessive sweets and carbohydrates. There will be a detoxification period as we balance your blood sugar and increase your energy, and we'll show you the proper way to exercise. We'll provide educational materials and videos that teach the science behind our treatments, the nutrition, detoxification, and how to avoid going back to old habits. But you will be the one who's responsible for your results and maintaining them.
I was very discouraged because I know how to eat right. I've been eating organic for a long time, but I still was not experiencing any weight loss, and I wanted to get my weight loss under control. I have a goal that I want it to be, and the older I get, the more I want to be in control of my body.
Well, you see, I thought I was just tired from moving, but I wasn't myself, I knew, because I didn't want to drive much, which isn't like me. So I just didn't have any idea, except my husband finally said to me, I think we need to find out what to do.
I had been trying to do so many things. I've been trying to work out, I've been running, fixing parts of my diet, and I just was not seeing any results, period. I was very minimal results. I was maybe getting a little bit stronger here and there, but you know, I kept retaining the body weight.
Psoriatic arthritis, fibromyalgia, extreme overweight, hormone issues, thyroid issues, not feeling healthy.
Before I came in, I mainly came in because I saw that Dr. Filippini worked with thyroid issues, and that was my main concern. I'd been on medication for 11 years and my thyroid condition had gotten worse and not better.
I've been on prednisone for a year and a half, along with methotrexate and hormone replacement therapy, antidepressants for years. They had finally started me on a biologic, like Symphony, which is the injections, and I didn't want to take that. I didn't want to drop my immune system down to nothing.
First of all, I'm in tune to my body. I'm excited that I can feel a healing going on within.
So far, the results have been phenomenal.
I guess I didn't mention this earlier too. When the test results all came back, one of the things that flabbergasted me was that my cholesterol was really bad, my triglycerides were really bad, and in fact I was in metabolic syndrome. I was pre-diabetic. And how could that happen when I was under treatment all this time? About 3 months into the treatment program then and making the lifestyle changes, we did some of the blood work again, at least in the areas that were of concern. Out of 57 things that were tested, 15 of mine were flagged as being issues. And the nice thing about that is that aside from my thyroid, still needing some help, all of the other things went to normal. Glucose, triglycerides, cholesterol, iron, sodium, all of those things that had been issues were all normal levels after 3 months.
I've already lost 30 plus pounds. I feel fantastic. My sleep has gotten better. It's been an excellent experience so far. I've just gained a better sense of knowledge on what goes into my body, how my body operates, and what my body's capable of, the healing process of my own body.
I feel like I'm back to being my more upbeat type of person.
Just the first 6 weeks, dropped 12 pounds. In the last 40 days, I've dropped another 28 pounds.
As I was driving here, I realized I am back to who Deanna was. And it was exciting. I just could hardly wait to get here and tell everybody I feel so good.
I have the energy to exercise now. I sleep better. I concentrate better. I have to buy new clothes.
I want to answer a few questions that we normally get. Does my insurance cover this? Well, straightforward answer is no. Insurance companies are for-profit industries. They do not make their investors money by paying for things that get you healthy. You are currently getting the health care that insurance is designed to cover, drugs and surgery. They will keep paying for medications that will lead to more medications, that will lead to further complications, that will keep you paying higher premiums and relying on them. I'm sorry if that sounds harsh or even offends you, but the statistics, they just don't lie. If you have a chronic illness and you aren't getting better, you're getting worse. Another question is, how much does this cost? The best I can do with this question is to ballpark the answer for you. Everyone is different, and the cause of their thyroid problem is different, and so the treatment is different, and the damage that needs to be repaired is different. That being said, I have different programs that I'll go over with you during your examination. I have programs that start at a couple $1,000s and go up all the way to over $10,000 for some of my more complicated cases. But I'll promise you this, I'll be straightforward with you. I'll make my best recommendations based on my exam findings, the paperwork that I'm going to have you fill out, and what you're wanting to accomplish with your health while you're under my care. No bait and switching pricing. Keep this perspective, however. You can keep spending extra money on doctor's visits and co-pays and deductibles while you manage your condition and it continues to get worse, or you can make an investment in your health that will pay dividends. Okay, let's reiterate my questions that I've asked during this video. Number one, why does your doctor wait to start treating you until you have a full-blown disease that needs to be managed with constant doctor visits and medications? Number two, if you have to keep taking those medications for the rest of your life, are they fixing the problem or causing new ones? Doesn't it make sense, number three, to treat the cause instead of managing the symptoms? And number four, ultimately, who's responsible for your health? Is it one, the government? Two, your doctor? Three, the insurance company? Or is it number four, yourself? Life shouldn't be a chore, just getting out of bed in the morning. Your energy levels shouldn't be in the dumps. Your hormones shouldn't be all over the place, and you shouldn't be struggling with your weight, especially when you're eating the proper foods. Now, if you've already scheduled an appointment, I look forward to being a part of changing your life, and as I have with so many others before you. Now, if you haven't, don't continue to suffer needlessly. Call us today at 925-718-8759 and take advantage of my low-priced exam special. God bless.